Hi everyone. So today we will be talking about structural family therapy. We're going to start off with a brief overview on the topic, and we are going to also talk about the importance of addressing family dynamics in therapy. So, structural family therapy, otherwise known as FST, is a therapeutic approach designed to improve the functioning of families by addressing and restricting existing dynamics between family members. So this model basically addresses the importance of the family unit instead of just the individual. Each member's behavior is interconnected and influenced by interactions within the family unit. So basically, it looks at the family unit as one of the reasons that underlie an individual's behavior. So why is it really important to address family dynamics in therapy? Family dynamics are crucial in shaping individual behavior and emotional well-being. Dysfunctional patterns within families can contribute to stress, conflict, and mental health challenges. By addressing these dynamics, structured family therapy provides an effective framework to resolve conflicts, strengthen family bonds, and promote healthier communication among family members. This is especially important for younger children where their family or their home is kind of their primary agent of socialization. So, structural family therapy was developed in the 1960s by Salvador Minichin, a renowned psychotherapist who sought to address challenges in underprivileged families. His work basically emphasized the importance of reorganizing the family structures to achieve a better family functioning. And by better family functioning, I really mean a more healthy family dynamic. So the historical context of SFT is pretty interesting because it emerged during a time when psychotherapy was actually largely focused on the individual instead of a family unit or a society. Minichin shifted the focus to the family unit, recognizing that systematic issues often underlie psychological issues. So his early work with economically disadvantaged families revealed that by addressing family dynamics, it could lead to significant improvement in individual outcomes. Minichin was deeply influenced by systems theory, which basically views families as complex interdependent systems that are also influenced by other factors. For example, it focuses on the family as well as focusing on the neighborhood the family is in, then in a larger picture, the community, the country, the society, etc., etc. So he was deeply influenced by this theory, and he also drew on existing research on family dynamics, and he integrated these concepts into a practical therapeutic model that we know now as structured family therapy. Okay, and now it's time for a multiple choice question.
Okay, so now we are going to talk about the philosophy of structural family therapy. Structural family therapy was developed by Salvador Minuchin and is based on the belief that family structure directly influences individual behavior. So rather than seeing a problem as existing within an individual, SFT looks at how family dynamics create and maintain these issues. The goal of this therapy is to change these structures to create healthier family interactions. The core idea was best explained by a quote that I found in Minuchin in 1974. The quote is, "Therapy based on this framework is directly towards changing the organization of the family. When the structure of the family group is transformed, the position of members in that group are altered accordingly. As a result, each individual experiences change." So what this means is that SFT sees behavior as a reflection of the family's organization. Instead of focusing only on the individual, therapy examines the entire family structure to identify the patterns that need to change. So an example of this is, imagine a teenager who's struggling with anxiety and acting out. Traditional therapy might focus solely on their emotions and coping skills, but SFT asks, how does the family contribute to this anxiety? Are parents overly controlling? Are there blurred boundaries? By restructuring family interactions, we create an environment where the teen can thrive. Now, let's break down the core principles of structural family therapy and why they are essential in helping families function in a healthier way. So first, we have to see family as a system. So what this means is that SFT sees the family as a structured system where each member's behavior is shaped by the system's rules, and communication patterns. If the system is healthy, members interact in a balanced way. But if the system is dysfunctional, unhealthy behaviors arise and become reinforced over time. The next thing we have to take into account is the rule of boundaries. So boundaries define how close or distant family members are from one another. When boundaries are too rigid, family members become disengaged, meaning they are emotionally distant and disconnected. But when boundaries are too loose, families become diminished, meaning there's too much involvement in each other's lives, often leading to overdependence or lack of autonomy. Then, we have to realize that change requires structural reorganization. So one of the main goals of SFT is to change the way families interact by restructuring power dynamics, rules, and communication. Dysfunctional patterns don't just disappear. Families have to actively shift the way they function in order for change to happen. Then we also have to recognize that therapists in this therapy act as an active agent of change. So unlike traditional therapy, where the therapist is a passive listener, SFT therapists actively engage with the family by joining the system. This means adapting to the family's communication style in order to gain their trust and guide them towards healthier interactions. Lastly, we have to take into consideration cultural considerations. So family structures are not universal. They are shaped by culture, traditions, and societal norms. While SFT was originally designed for Western nuclear families, it must be adapted to respect the values of different cultural family systems. So, to conclude, structural family therapy is all about understanding how family structures influence individual behaviors, making intentional changes to improve communication, power dynamics, and emotional boundaries. The therapist doesn't just observe, but they actively reshape families' interactions to create healthier, more functional relationships. By changing the structure, we change the system, and that's what leads to lasting change. Okay, so now it's time for a question. Please scan the QR code to answer.
Now that we've learned about the philosophy of SFT, let's go over the key concepts. Here we have a brief overview of the key concepts, and we'll go over them in more detail in the following slides. Family structure refers to the invisible rules that govern how family members interact. Healthy families adapt their structures as they grow, but when these structures become rigid or maladaptive, problems often arise. SFT works by recognizing and modifying these patterns to create healthier relationships. Families consist of different subsystems. The parental subsystem involves decision-making and leadership. The sibling subsystem shapes peer relationships. And then finally, the spousal subsystem provides emotional support. When these subsystems become unclear or overlap with one another, conflicts can arise. Structured family therapy helps to clarify roles and ensure proper functioning. Boundaries regulate emotional closeness in families. Clear boundaries allow for connection while maintaining interdependence. Rigid boundaries lead to disengagement, where family members are too distant with one another. Diffuse boundaries, on the other hand, cause enmeshment, where family members are overly involved in each other's lives. Therapy works to establish clear but flexible boundaries. Hierarchy is important in family dynamics. Parents should be in leadership roles, guiding their children. When children take on too much power, such as making major decisions or acting as caretakers for their parents, the family structure becomes imbalanced. Therapy helps to restore a healthy power structure. Before making any changes, the therapist must first join the family system by building trust and rapport. This is done through accommodation, where the therapist adopts the family style of speaking and interacting. By doing this, the therapist earns the family's confidence and can guide them through restructuring. Restructuring is the heart of SFT. The therapist actively works to shift patterns of interaction within the family. This may include rearranging who speaks to who, assigning new responsibilities, or directly challenging unhealthy dynamics. The goal is to create lasting changes in family relationships. Rather than just discussing issues, SFT encourages enactments, where family members act out conflict in therapy. This allows the therapist to observe real-time interactions and step in to make adjustments. This hands-on approach helps families practice new ways of communicating. Reframing is another powerful tool in therapy. Instead of blaming one person for a problem, the therapist helps the family see how their patterns contribute to the issue. For example, instead of saying a child is rebellious, reframing might suggest that they are seeking autonomy in a restrictive environment. This approach reduces conflict and promotes understanding within the family.
It's time for another question. Please scan the code and answer on your device.
This section will now explore the goals of structural family therapy. The main goal is to address problematic relationships and structures in the home in order to improve the family dynamic as a whole. Firstly, restructuring family boundaries is one of SFT's primary objectives. It is crucial to draw appropriate and distinct boundaries between family subsystems, such as between parents and kids. This helps avoid disengagement, in which family members grow distant and lonely, or enmeshment, in which members become excessively interested in one another's lives. Strengthening the parental subsystem is another important objective. Parents must act as a cohesive leadership team, offering direction and stability. Unsuitable levels of authority that children take on can strain family relationships and cause conflict and dysfunction. Through the identification and modification of negative interaction cycles, SFT also focuses on altering dysfunctional family dynamics. Families frequently engage in recurring patterns that exacerbate conflict. Therapy contributes to the development of a more wholesome family environment by encouraging more supportive and adaptable behaviors. Another crucial objective is to promote adaptable family roles. Individual development and family peace may be hampered when family members are forced into inflexible roles. Members of therapy are encouraged to take on tasks that suit their needs and capabilities. Additionally, treatment relies heavily on enhancing family communication. Direct and honest communication improves comprehension and fortifies emotional ties. Positive interactions occur when family members are encouraged to communicate their ideas and feelings in a healthy way. Lastly, by assisting families in adjusting to stressors and life transitions, SFT seeks to foster family adaptability. The family can overcome obstacles together in a positive way if resilience and good problem-solving techniques can be developed. In general, structural family therapy aims to address major dysfunctional areas in order to establish a more supportive and functional family structure. Families can build better bonds and healthier interactions by focusing on communication, role flexibility, adaptability, and boundaries. Now here's a multiple choice question. Please scan the code. Now, moving on to the roles in structural family therapy. For the therapist's role, in order to help the family restructure interactions and foster healthier relationships, the therapist in structural family therapy serves as a leader. The foundation of a therapy is trust, which allows clients to freely discuss and fearlessly examine personal issues. Collaboration, self-discovery, and long-term development are encouraged when the client and therapist have mutual trust. The therapy also acts as a boundary setter, assisting family members in creating flexible and unambiguous boundaries that promote self-reliance and closeness. Finally, the therapist serves as an inspiration for change by using strategies like enactments to modify family dynamics and promote better communication and problem-solving abilities. And for the client's role, family members are essential to the therapeutic process as well. They actively participate in activities intended to expose the family structure and prevailing patterns of relationships. They collaborate with the therapist to change dysfunctional interactions and behaviors. Lastly, family members act as change implementers, using newly acquired techniques outside of therapy sessions to maintain and strengthen constructive relationship changes. Both clients and therapists contribute to the success of structural family therapy by carrying out these responsibilities. Family connections become healthier and more productive as a result of the organized approach, which helps families make long-lasting improvements in their interactions. Now here's a multiple choice question. Please scan the code.
Okay, so now we are going to talk about the phases of structural family therapy. Structural family therapy follows a structured process to identify, challenge, and restructure dysfunctional family patterns. This therapy typically includes 3 main phases. The first phase is joining and assessing. So this is actively engaging with the family. The therapist builds rapport, observes interactions, and maps the family structure. The therapist joins the family system to absorb relational patterns and establish trust. Then, a family map or a structural assessment is created to identify hierarchies, subsystems, and boundaries. The goal is to see how the problem is embedded in family interactions rather than just an individual. The next step is restructuring and intervention. So you're actively challenging dysfunctional patterns. The therapist disrupts dysfunctional family structures and introduces healthier patterns. The therapist challenges rigid hierarchies, enmeshment, or disengagement within the families. Using techniques like enchantment, which is acting out conflicts in therapy, and balancing, like shifting power dynamics and boundary making. This encourages family members to interact in new ways to promote healthier relationships. And lastly, you have to consolidate and terminate the changes. So we're maintaining the change. We have to ensure that the family can sustain positive changes without the therapist present. The therapist reinforces new interaction patterns so they become self-sustaining. Family members are encouraged to handle future conflicts using healthier strategies, and therapy ends when the family system functions independently without external intervention or the therapist.
For theoretical assumptions, family systems theory states two assumptions about a family. First, the family system is intrinsically connected, so all experiences can influence other parts of the system. And second, behaviors are defined by their functions within the family. This means that behaviors are not just labeled as good or bad, but may require a more thorough examination in the context of family interactions. In SFT, the integration of subsystems assumes that family structure consists of rules and a hierarchy where parents are considered the most powerful and older siblings have more responsibility than younger siblings. Another assumption is that boundaries must be clearly defined, otherwise a family can't operate successfully and is at risk of experiencing conflicts or violence, such as sibling abuse. And then the assumption of competence points to the framing of families' problems. In SFT, the problems that families have are not because something is inherently wrong with the family, but because the patterns that they're using might not be useful for their current circumstances. And this leads therapists to motivate and guide families to leave behind these patterns and try to uncover alternatives. And lastly, an important assumption is that each family is fundamentally unique. Interventions have to be tailored to a family's history and subjective experiences, and they shouldn't be targeted for a specific change or outcome because each family's uniqueness will bring about a different change. Now, it's important to consider a therapist's biases because a structural family therapist is vulnerable to several biases during their client sessions. So, taking sides with family members or reinforcing power dynamics may be a result of unconscious bias if a therapist has more interactions with one family member or acts on assumptions of family roles. And therapists might also overlook the details of individual experiences within the family because of the focus on the overall family system that structural family therapy takes. And this possibly leads to neglect of individual needs or root causes of certain individual behaviors. And lastly, countertransference is a common occurrence that therapists must be aware of. And in the case of structural family therapy, the therapist might encounter situations where they become overly involved or overly critical of certain family members, like being protective of a child in a family situation that maybe they relate to in their own life. So it's important that the therapist remains in a neutral position and learns to be self-aware of these potential emotional reactions.
Here's a discussion question. Please scan the QR code to answer.
In terms of evidence-based research, studies have shown the effectiveness of structural family therapy in couples with marital dissatisfaction. So, for example, Delgandi and Namani's 2024 study used a semi-experimental design for 30 couples in Iran who were referred to a counseling center due to marital violence and family disputes. And they were randomized to 3 groups: structural family therapy, mindfulness-based family therapy, which was a therapy that helps families gain coping skills to control stress and anxiety, and the third group was a control group, so no therapy. And the authors used a 20-question tool to measure cohesion and adaptability, and these 2 components have been shown to enhance a couple's level of satisfaction in their marital life, which also helps to reduce the risk of separation and divorce. And the authors found that SFT was more effective than mindfulness-based family therapy in improving couples' cohesion and adaptability. And other studies have also supported the use of SFT in increasing family unity and cohesion. But for this study in particular, there were some limitations, including the small sample size. So 30 couples means that maybe the study is underpowered and could have led to a false statistical significance in the results. And also, it didn't account for some potential confounders like financial status and employment, which are factors that can affect marital life as well. There are other studies that have examined the use of structural family therapy for other populations, for example, adolescents with behavioral issues. So in Lee's study, the author conducted 3 separate case studies for adolescents with different conditions, including anorexia, suicidal ideations, ADHD, and autism, and they found that SFT was effective for a number of different reasons. One of the reasons was restructuring the family system. So because adolescent behavioral issues are closely related to family dynamics, structural family therapy's focus on structural issues helps to reset family boundaries, adjust interaction patterns, and promote effective communication. And other benefits were promoting emotional connections, like emphasizing the mutual support and understanding of family members. Also, it helps to use resources and strengths of what the family already operates on, like their love for each other or their communication skills. And it also provides adaptability and flexibility for families with diverse cultural needs. Then in terms of limitations, the authors mentioned some of the limitations, including family participation, so maybe some members were resistant to therapy. And then there was also the simplicity of intervention for more complex cases. And there's still a need to balance cultural adaptability within these structural family therapy sessions. And there's also difficulty in monitoring and maintaining changes in the long term. And this may be due to inconsistent support mechanisms for families.
An example of a hypothetical case study includes 2 parents who are dealing with a teenage daughter who is exhibiting behavioral issues. Their daughter is constantly arguing with authority figures, breaking rules set by her parents, and crossing many boundaries. The core problem seems to be a lack of boundaries and authority imbalance within the family system. These issues are beginning to impact the daughter's grades in school and her relationship with her parents. After reviewing limitations to confidentiality and obtaining consents, the therapist will ask about the presenting issue. This will include questions about when the problem started, what else was happening in the family around this time, how long the problem has lasted, and if the problem has gotten any better or any worse. The goal of the initial assessment is to also uncover any underlying relationship dynamics and hierarchies within the family. Questions should not only be directed at the child's behavior. The therapist should cover all possible factors that are involved in the presenting problems. For example, the therapist should ask about milestones, sleeping patterns, eating, academics, social functioning, family history, or any trauma that may have occurred to cause difficulty in the child's life. The therapist may implement a method called role-playing. Here, the therapist will ask the family to enact a scenario to observe how the family would normally interact in the face of conflict and identify any areas of improvement. The goal here is for the therapist to interject and correct any behavior that is unproductive and help improve communication. For example, the family may be asked to role-play a curfew conflict scenario where the daughter comes home past her set curfew. When role-playing, the therapist may ask the parents to express concerns about broken curfews and focus on remaining calm and assertive while establishing clear boundaries with their daughter. The daughter may be asked to react as she normally would during this type of conflict. This will help the therapist understand how the family system normally functions and communicates. Another area the therapist may work on with the family is setting clear and firm boundaries. For example, the parents may ask the child to adhere to a curfew of 9 p.m. on school nights. If this boundary is crossed, the parents may implement a punishment of taking away their daughter's phone or car privileges. This will help the parents reestablish their authority role within the family system. Subsystems should also be addressed in structural family therapy. The therapist may only work with the parents as a separate subsystem of the family. Parents must work together to establish common goals and boundaries with their daughter. By working together, the parents will also be able to strengthen and encourage each other to enforce these boundaries. Finally, the therapist may implement the method of reframing. Reframing helps families look at problems in a new light. The daughter's behavioral issues may be a cry for help. For example, having overly permissive parents may make their child feel as though her parents do not care enough about her or pay enough attention to her. Understanding the root cause of the child's behavioral issues will make it easier to address these issues and improve upon them.
While structural family therapy is considered to be highly effective in restructuring family dynamics, it does have some limitations. One major criticism of SFT is its overemphasis on structure at the expense of emotions. This approach highly focuses on observable interactions, like how family members behave in the present. It often downplays deeper emotional experiences, past trauma, or psychological wounds. For example, a child's rebellious behavior might be seen as a problem with family hierarchy, but in reality, it could stem from unresolved trauma or emotional neglect. Since SFT does not focus heavily on exploring past experiences, it may overlook these critical underlying issues. Another challenge is the potential for therapist bias when joining and restructuring the family. In SFT, the therapist actively engages with the family, adapting to their communication styles to create trust. However, there is a risk that the therapist may unintentionally align with one subsystem over another. For instance, if the therapist sympathizes more with the parents over the children, they may reinforce parental control rather than challenging unhealthy power dynamics. This can even worsen existing family struggles instead of resolving them. One of the most common tools in SFT is the use of family maps to visualize relationships and hierarchies. While helpful, these maps can oversimplify complex family dynamics. A family is not a fixed system. It constantly changes due to life events, personal growth, and external influences. A static map may not capture these fluid interactions, leading to interventions that do not fully address the real challenges the family faces. For example, a parent-child conflict might be mapped as a strict power imbalance, but in reality, it could fluctuate based on the situation. If the therapist relies too much on the structural model, they may miss these nuances. The final limitation I'll discuss is cultural applicability. SFT was originally developed based on Western family models, where parents lead and children gain independence over time. However, in many collectivist cultures, extended family members such as grandparents, aunts, and uncles play significant roles in decision making. SFT's emphasis on clear boundaries and autonomy may clash with cultural norms that prioritize interdependence. Another example of this is how in some cultures, a child's close involvement with parents well into adulthood is seen as normal. SFT, however, might view this as enmeshment. If a therapist applies SFT too rigidly, they may pathologize normal cultural dynamics, leading to misguided interventions.
Structural family therapy may not account for cultural variations in family structures and dynamics, which can lead to misunderstandings or ineffective treatment. Culture is a source of unity, cohesiveness, and identity, so it is important to recognize and implement culture in SFT. Future research may incorporate different cultures when analyzing the efficacy of SFT, and further, culture should be considered when matching therapists with different families. Now it's time for a discussion question. Please scan the QR code. Future research may also look at the oversimplification of family mapping. To address this, we may use longitudinal studies to track families over time using multiple family maps. This will provide a more comprehensive and holistic view of the changing familial hierarchies, and this may later be implemented into SFT practice. Structural family therapy aims to resolve issues and conflicts within the family system, understand the individual with respect to their family, use active interventions such as role-playing to resolve conflict and improve communication, improve dysfunctional subsystems within the family, and help with issues related to things like divorce, remarriage, blended families, or even death in the family.
Thank you all for watching. We hope you enjoyed learning about SFT and have a better understanding of how this therapy works.